Hello, welcome to my video on coronavirus disease, a disease currently affecting thousands of people across the world. To help you better understand, I'll start off by differentiating between two terms. The first one, COVID-19 or coronavirus disease, is the name of the disease that is spreading across the world right now, while severe acute respiratory syndrome coronavirus 2 is the name of the virus responsible for causing coronavirus disease or COVID-19. In this picture, you can see the structure of coronaviruses, and we'll notice that they all have crown-like projections on their surfaces. As such, coronaviruses get their name from these crown-like structures. A little more about this disease called coronavirus disease or COVID-19. It is a disease that instills fear in many of us, as we are aware that it is spreading at a very fast rate. There are no vaccines to fight the disease. Neither a specific way of treating it has been finalized, and treatment currently administered to patients only treat the symptoms rather than the cause, so our fear is totally justified. Now let's take a look at some general facts about coronaviruses. It is important to note that they are not a new type of viruses. Coronaviruses were isolated for the first time in 1937 as a virus causing infectious bronchitis in birds. Evidence of human coronaviruses was obtained in 1960s, and two of them were found to be causal factors of about 15% of common cold cases in adults. Nowadays, various groups of coronaviruses are known that affect birds and a variety of animals, including humans, and these impact different parts of the body, not just the respiratory tract. At this point, the question that arises is, has the virus causing COVID-19 been transferred from other animals to humans? The answer is most likely yes, especially when we consider the fact that the genetic makeup of the virus responsible for this worldwide pandemic shares 96% similarity with a specific bat coronavirus. Now that we have a better understanding of the coronavirus disease and the virus causing it, let's consider the symptoms that could indicate a possible infection with the coronavirus. Common symptoms include feeling of tiredness, runny nose, cough, sore throat, trouble breathing, asthma attack in asthmatic patients. However, it should be noted that one big difficulty in correctly identifying the symptoms of COVID-19 is that the symptoms are very similar to those of common cold, hence making it hard to tell if someone is suffering from COVID-19 or common cold. The next thing that we should know is how to protect ourselves from this virus. Avoid crowded environments, avoid meeting people who have recently traveled to countries with major coronavirus disease outbreaks. Avoid traveling to countries with high infection rate. Limit all travels as far as possible. Avoid contact with animals. Wash hands with soap frequently. Use sanitizers to keep your immediate environment clean and free of germs. Avoid touching your face, eyes, mouth, and nose to avoid cross-contamination. Limit eating out and do not eat food prepared by colleagues and friends, as you never know. Even if they look healthy, they do not show any symptom, they might still be infected. Stay a few meters away from people who are sneezing and cover your mouth and nose if possible. In case you contract the infection, there's no need to panic, as in most cases, people get cured within a few weeks. It's only in very few cases that it degenerates into more complicated lung infection. However, you need to take necessary measures if you're infected to ensure that you do not contaminate other people. Some measures to consider are wear a mask, a face mask, avoid meeting people, that is, implement self-quarantine, avoid sharing personal household items, avoid traveling as far as possible, avoid contact with animals and pets, wash hands with soap frequently, do not share the food you have prepared with others, Always cover your mouth and nose while sneezing and coughing. Use sanitizers to keep your immediate environment clean and free of germs. This is the end of part 1 on coronavirus disease. Please subscribe to my channel to receive notifications of my next video on coronavirus disease, where I'll be discussing how the virus affects our body cells and cause respiratory problems. Thank you.